A 30-year-old man presented 12 months after blunt trauma to the right eye, complaining from progressively blurry right superior visual field. The right visual acuity is 6/5 and there is an inferior macula on bullous detachment related to retinal dialysis. So the question is on retinal dialysis. It's a very direct question, and the question is asking what is the most appropriate surgical repair. So the question, in simple words, is asking about the surgical repair of retinal dialysis. Drainage of fluid plus inferior cryotherapy, plana vitrectomy and silicone oil, drainage of subretinal fluid and inferior scleral buccal, or plana vitrectomy and 20% SF6, plana vitrectomy and 12% C3F8. Questions in Royal College exams come with only 4 options. The 4th and the 5th options here I would consider the same. So the idea is it's PPV plus gas. The gas goes up, so it mainly tamponades superior parts or the temporal and nasal quadrants if you ask the patient to position. This is not a vitreoretinal exam, but bear in mind it's inferior detachment, so no role for gas here. Drainage of fluid and inferior cryotherapy. Okay, there is no buccal applied, no vitrectomy, so I wouldn't say this is a valid option at all. Second option is plana vitrectomy and silicone oil, or drainage of subretinal fluid and inferior scleral buccal. Treatment for retinal dialysis is with a buccal. This is something to memorize. This is in contrast to giant retinal tears. So GRT are retinal breaks of more than 90 degrees, more than 3 clock hours, and they have different pathophysiology from retinal dialysis. So in giant retinal tears, the vitreous is attached to the anterior lip of the break, and in some cases the vitreous even goes subretinal. So giant retinal tears has rolled posterior lip of the break, which needs plana vitrectomy to be unfolded. In contrast to dialysis, in dialysis, this is a circumferential break, takes place due to disinsertion from the aura serrata. It usually happens following trauma, around 64%. I would say this is around 2/3 of cases. Only 1/3 might be spontaneous or unrelated to trauma, I would say. This is around 35, 36, 34%. In retinal dialysis, this is not associated with posterior vitreous detachment. That's why this question, you can tailor several or numerous questions from this question. So 30-year-old man, this means he's young in age. So being young in age means that most likely he has no PVD. And without a PVD, we prefer a scleral buccal. Scleral buccal in this young age might be protective for the lens as well. So 80% develop significant cataract or need cataract surgery within the first year post PPV. This is something that you can't avoid, but after scleral buckling you don't get this cataract. The second piece of information is blunt trauma. So blunt trauma might cause dialysis. After blunt trauma, dialysis might occur superonasally, by the way, while inferotemporally happens frequently. Superonasally is very frequent in trauma. Next question, 21-year